If you're doing yoga while you're pregnant or postpartum and you're searching for a great app, I want to share with you my favorite app. It's called the Down Dog app. I have no affiliations to them. They don't even know I'm talking to you about this, but I love it because it is so adjustable and modifiable to what your needs are, how many minutes you're doing your yoga practice for, like what type of yoga you're doing. Like there's 8 different types of yoga styles that they offer, and every single workout is different, and that's what I personally like. And of course, you can grade how difficult the practice is. So right now, they're offering a 67% off for the year. It is the biggest deal. So if you are interested again in a yoga app, this is what I would definitely check out. I think it's like $20 US dollars for the year. Otherwise, it's whatever it is, $67. So check it out, friends. This would be something to follow up with a family physician or a GP. The OB-GYN would have discharged the patient at 6 weeks postpartum, which is probably why they don't want to help, which is also too bad. Now, every body is different, so what you want to make sure is that there is decreased pain and increased mobility either over days, weeks, or months. Those are the results you want to see. Now, part 3 is aesthetics. Aesthetics will and may improve depending on a lot more factors. One of the biggest factors being exercise and movement. Is that athlete moving well? And is that athlete moving regularly? The way I define the C-section shelf, which is a non-medical term, by the way, yes, is right on the scar. It's when that tight scar tissue creates an overhang above and or below the external incision. Anything after 6 months postpartum, generally I would suggest an in-person assessment with a perinatal therapist because they would be able to determine if scar massage would be helpful and what kind of result you are looking for if that can happen. Generally, yes, if you've been discharged by your surgeon and you have no infections, you want to be able to help that scar mobility by doing scar massages and corresponding scar mobility movements. So yes, for sure, get started. It's common for sex to be painful after cesarean due to fascial tension created by that incision on your belly. And there's actually 3 incisions, so that can pull up on the pelvic floor, causing pain during sex. Now, what can we do about painful sex due to fascial tension? Fascial mobilization techniques. And that's a type of scar massage. So definitely, if you want to learn how to do this on your own, you can through some of my programs or with a perinatal therapist. You no longer need to do scar massage if you don't see any improvement. So specifically, be looking for improvements in pain and mobility in the localized area, but also during exercise and movement. While this can occur, it doesn't have to be your new normal. So please check with your doctor and or your naturopath and see what the plan is best for you. If by belly binders you mean ab wraps or compression garments, then yes, absolutely. They help in the first 6 weeks with swelling, pain, and function. A really great thing to use to protect yourself while you're healing. There are different massage techniques for your specific stage of healing. So you want to make sure that you're starting out with the correct ones and also progressing them. Watch my Q&A from today, and in the first section, I talk a lot about them. Hello, Instagram. It's Jeanette Yee, your perinatal athletic therapist, and it's Monday Q&A at 2:15 Eastern. So we have quite a few questions that have already been put into the question. It's never too late to make changes in your scar, but there is an ideal window of self-scar massage, and that's in the first 6 months postpartum. After 6 months, it'll be probably better for a perinatal therapist to do your massage. The reason for this is because you want to have a skilled practitioner to be able to manipulate your tissues in the ways that it needs, right? By the 6-month mark, things have they've set quite a bit. While remodeling still occurs, you won't be able to do it yourself. Here's my professional take on this. Scar strips are helpful to protect your scar, protect it from things like irritation and from picking and scratching. But it is a tool in conjunction with other rehabilitation tools like scar massage and exercise. After the 6-month mark, make sure you know the cause of your overhang or C-section shell if you want to make a difference. There's so many causes, and it's important to treat your cause. So after the 6-month mark, it's not only due to tight scar tissue. Emotional health is such an important factor in physical healing, and I really, really encourage you to work through your birth experience or birth trauma from your first cesarean. I'm going to link a couple of really great accounts here. There's a checklist of exercises that you want to be able to do before you return to postpartum running. And this is the same checklist of exercises whether you had a vaginal or cesarean birth. Take a look at them below. It is so awesome that you are back to movement. Now, make sure you have your ABCs in check first. Make sure you know how to transition and apply those to your daily activities, as well as your diastasis exercises, as well as your 7 primal movements. Take a look below. Hello, and welcome everybody. Welcome to Ask Jeanette. I am your perinatal athletic therapist, Jeanette Yee. And today we have an Instagram live with Dr.